I have a specific amount of time at the end of the session, and then unmute your mics if you have questions, and we can answer questions that way, or if you felt comfortable to type them in, then that's okay. I also ask if there's dire questions that need to be answered during the time that I'm presenting here, then feel free to do so. Then I'll try to answer them. A lot of information, like I said, so any question is just to give you an idea as to who I am. I'm an art therapist, and have my own private clinical 5 years, and I primarily work with children and adolescents and who've experienced trauma, separation and loss, those who are going through divorce, children in foster group homes. And at the end of presentation, closer to the end, I'll be presenting a case someone that I've worked with and be able to see their artwork as well as my fun. There's a problem with the sound. How is my sound for everyone? On and off. So how is it right now? So I'll try to speak a lot louder, as well as to keep my microphone closer to my, hopefully that will help, but just to let me know if you can hear, or if it continues to go on and on.
A quick question.
Yeah.
Do you have your mic on continuously, or are you okay? It seems to be cutting out, and that is often symptomatic of something else running on your computer at that time, or possibly problems with your internet provider.
Okay.
So just if you have any other programs that are running besides this, shutting them down might help.
Okay. Let me see. Trying to troubleshoot here, so everyone bear with me. Just continue to let me know how this.
A big culprit might be a virus protection program.
Oh yeah, that's a good point.
Okay, let me have a look at that, and I can probably just turn that off for the hour, and then.
Then we'll send you all sorts of dirty email.
Keep those
Okay.
pictures to yourself.
No, I didn't mean that kind of dirty. And let's not try to work it out too hard. We'll just kind of we'll listen for the bits and pieces, and we'll put it together as a gestalt.
Okay. How is it right now, the sound? Is it a lot better?
It seems to be a little bit, no. Some people are saying no, but it seems some people are saying same, some people are saying better.
Okay.
All right. Progress, not perfection. Let's move on.
Let's try and work through it then. So to just give you a brief background, I wanted to let you know what psychotherapy is, just to give you an idea for those who don't know too much about art therapy, but to understand psychotherapy is much fundamental. So psychotherapy, or personal counseling with a psychotherapist, is an intentional interpersonal relationship that is used by trained psychotherapists, such as myself, to aid a client or patient in problems of living. And it aims to increase the individual's sense of their own well-being. And psychotherapists employ a range of techniques based on relationship building, dialogue, communication, and behavior change. And they're designed to improve the mental health of the client Psychotherapy may also be performed by practitioners with a number of different qualifications, and these can include psychiatrists, marriage and family therapists, music therapy, occupational therapy, counselors, psychiatric nurses, psychoanalysts, psychologists. There's a number of different people that can use psychotherapy. So the word psychotherapy comes from the ancient Greek word psyche, meaning breath, spirit, or soul, and it was first noted around about 1890, and it is defined as the relief of distress or disability in one person by another, using an approach based on a particular theory or paradigm of the therapist. And that agent performing the therapy has had some form of training in their delivering it. So psychotherapy was first developed in the Middle East during the 19th century by a Persian physician and psychological thinker named Raz, and who was at one time the chief physician of the Baghdad hospital. At that time, within Europe, there was serious mental disorders and were generally treated as demonic or medical conditions, requiring punishment and confinement until the change of moral treatment approaches in the age. And psychoanalysis was perhaps the first specific school of psychotherapy developed by Sigmund Freud and others through the early 1900s. And trained as a neurologist, Freud began focusing on problems that appeared to have no discernible organic basis, and theorized that they had psychological causes originating in their childhood experiences and the unconscious mind, rather than the demonic conditions that they believed that they. And Freud used techniques such as dream interpretation, association, analysis of the id, ego, and superego, which I'm sure all are familiar with. Here we have a bunch of psychotherapy theorists, such as Anna Freud, Carl Jung, Erik Erikson, Melanie Klein, Heinz Kohut. So we hear a lot of these names, but it's great to put a face to the name and understanding their theories behind the work. Some theories of psychotherapy would include the psychoanalytic, and it was the first practice called a psychotherapy, and this encourages the verbalization of all the patient's thoughts, including free association, and dreams, in which the analyst formulates the nature of the unconscious conflicts which the patient. Object relations, which I'll focus on more, understanding art therapy, so I'll leave that. We have cognitive behavioral, which generally by different methods to identify and transcend cognition, beliefs, and reactions with the aim of influencing negative emotions. We have psychodynamic as a form of